Thinking about trying to conceive? You've come to the right place. Today on She Found Health, we're going to share our top 10 tips that you can do to prepare your body and mind for a healthy pregnancy. Now, if you haven't already got it, do make sure to take the time to download our free Preparing for Pregnancy tip sheet. We'll make sure we link it in the show notes below.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
So tip number 1, take control of your fertility. Some experts call this making your reproductive health plan. Others call it family planning. What does this really mean? It means taking a step back and looking at your overall life goals you've set for yourself and where, if at all, you see children fitting in with your goals for your education, career, travel, etc. It's important to focus on your goals at this moment and know that this plan may change. Heck, I started my training as an OBGYN, thought I'd never have kids, and that I was going to travel the world doing fistula repair surgeries in developing countries. And look at me now, maternity and family physician married with 3 crazy boys. If you don't feel ready to have children yet today, or you feel ready but you're waiting to find the right partner, you can still start taking the steps that we'll outline below to improve your health, protect your fertility, and improve your chances of having a healthy pregnancy when your time comes. And if you're currently sexually active and not wanting to get pregnant, talk to your healthcare provider today about reliable options for pregnancy prevention.
Number 2, curb your alcohol intake. Alcohol is a part of many people's lifestyle, but when planning for a pregnancy, it's important to ensure that you're following safe drinking guidelines. And if you're in a window of your cycle when pregnancy is a possibility, it's safest to abstain altogether. So safe drinking is considered 10 standard drinks a week for women or less, with no more than 2 drinks per day on most days. If you can, it's likely best to abstain altogether from alcohol while trying to conceive, but we know that that isn't always possible. So we'd recommend avoiding alcohol from ovulation or day 14-ish of your cycle to just before or until your next period.
Tip number 3, avoid recreational and illicit drugs. Many substances, including cannabis, opioids, and stimulants, can cause your menstrual cycle to be irregular, which can make becoming pregnant more difficult. These substances can interact with many of your hormones and neurotransmitter receptors and prevent ovulation, which leads to irregular periods and increased difficulty with conception. Cannabis in particular is concerning for a few reasons. For one, because it's derived from a plant, it's often perceived as natural, and people sometimes don't give it a second thought when using it in the context of trying to conceive or even pregnancy. Secondly, with the legalization of cannabis, access and use in reproductive age individuals is on the rise. THC, which is the main psychoactive component of marijuana, tetrahydrocannabidiol, acts on...
That's a mouthful.
Isn't it though?
Sorry.
No. So THC acts on the endocannabinoid system. Our body has its own internal system that makes cannabinoids and has receptors that these cannabinoids act on. The endocannabinoid system is found throughout the reproductive tissues in both sexes. Studies have shown marijuana can decrease sperm count by up to 30% in regular users. An irregular user is considered once a week or more. And as we discussed above, marijuana use may delay or inhibit, means prevent, ovulation. For most couples, ingesting marijuana does not affect time to pregnancy. However, for couples with subfertility or infertility, the impact of consuming cannabis on ovulatory function as well as sperm count may contribute to their difficulty getting pregnant. The endocannabinoid system develops early on in the fetus and plays a crucial role in brain development. This, combined with the knowledge that cannabinoids cross the placenta, is important to keep in mind when using cannabis products when you're trying to conceive or you're pregnant. Illicit substances and cannabis use is also linked to harmful effects on your pregnancy. If you're using recreational or illicit drugs and you aren't sure who to turn to, talk to your care provider today. We're here to help.
Number 4, quit smoking. The risks of smoking during pregnancy have been well established for a long time. We know smoking has a number of negative effects on not only the health of your growing baby, but also on your own health. The best thing you can do today for your health and the health of your future children is to stop smoking now. Ask your healthcare provider today how they can help you quit smoking. There is a lot of help out there to get you started. Check out Pregnets, Pregnets. It's a great resource for women who are pregnant or parenting and trying to quit smoking.
Number 5, book in for a medication review. Many medications are safe in pregnancy, but there are a handful that are not recommended due to increased risk of causing congenital anomalies or birth defects. These tend to be certain medications for mood and depression, blood pressure medications, seizure medications, as well as some blood thinners. The best way to prevent this and lower your risk is to book in for a medication review before you get pregnant and chat with your care provider. Oftentimes, we can do a review and make any changes that need to be made gradually over time and ensure you're on a stable dose of your new medication before you get pregnant.
Number 6, check your vaccination status. When it comes to vaccinations, there are a few infections that you can get during a pregnancy that can be harmful to the developing baby, like chickenpox or German measles, which is otherwise known as rubella. Those can be prevented with vaccinations. It's a great idea to check in with your care provider to see if you're up to date with these vaccinations, as we can't give them during pregnancy. What we would do is order a blood test to look for the antibodies, proteins in your body, that's made in the past if you were previously infected or if you were vaccinated. If you're not up to date, these vaccines can be safely given pre-pregnancy or post-baby to boost your immunity. Another vaccine that's important to be aware of is the HPV or human papillomavirus vaccine. If you're in the office talking with your care provider, you can consider discussing this one as well. For great information about HPV, visit hpvinfo.ca. Most vaccines we don't give in pregnancy, but there's actually one we routinely recommend for all pregnant women in their 3rd trimester, and that's the vaccine or booster for pertussis, aka whooping cough. So no need to get updated with that one, as we recommend giving it to you in pregnancy. The other one we often recommend is if you are pregnant or have a baby under the age of 6 months during the influenza season, is to get your flu shot as well.
Next tip, start taking folic acid today. Folic acid helps to prevent the abnormal development of the base of the baby's spine, which can result in spina bifida. We recommend all women of childbearing age, from your first period to the time of menopause, that are not on reliable contraception to add a regular folic acid supplement to their diet. Most women need 400 micrograms per day, though some women who are at higher risk require higher doses. We've got a blog post that provides a great and simple overview of what supplements are recommended in pregnancy, so we'll link to that in the show notes below so you can read more about what dose is right for you.
Number 7, get your PAP. PAP testing is a routine screen that's performed on women generally from the ages of 25 to 69. Recommendations vary slightly depending on what province you live in. It's a test done by your healthcare provider that takes a sample of cells from your cervix to test for any abnormalities in those cells that may put you at an increased risk of cervical cancer. In some provinces, we actually test for the human papillomavirus in your cells, which is what generally causes down the road to lead to cervical cancer. It's important to understand a few things about your PAP test. First thing is, not every pelvic exam is a PAP test. Sometimes women who have had STI or sexually transmitted infection testing think they're up to date on their PAP tests, only to find out they've never actually had one. If you're not sure, your care provider can access the past results. We know that almost all cervical cancer is caused by HPV, or the human papillomavirus. And as we mentioned above, this is also a great time to chat with your care provider about the HPV vaccine, as it's not recommended for women who are pregnant or breastfeeding. So if you haven't had it, you could consider getting this series prior to trying to conceive. Although previously only recommended for young women who hadn't become sexually active, new literature and evidence has shown us that although it works best and is most protective when given to young women prior to becoming sexually active, It continues to be protective for women, even if given at a later age, and even if they've previously been found to have HPV or abnormal pap tests.
Number 8, take a look at your lifestyle. When we say lifestyle, we're talking about your diet, your physical activity, sleep habits, etc. Eating well and being physically active before you become pregnant will help you prepare your body to meet the needs of the developing baby and give you the energy you need to grow a human being. The Canada Food Guide was recently updated and is a great framework for you to build a healthy diet on. If you have special nutritional needs, be that allergies, a vegan, keto diet, history of anemia, or an eating disorder, then talk to your healthcare provider today and they can offer guidance and recommendations and connect you with any specific health professionals to get your nutrition optimized for pregnancy. Women who are physically fit before and during pregnancy tend to have more energy and less aches and pains during their pregnancies. The Canadian Physical Activity Guidelines recommend for healthy adults 150 minutes of moderate to vigorous physical activity per week, and as little as 10-minute sessions or more. These activities can be as simple as a brisk walk or more dedicated like a scheduled fitness or dance class. If you haven't been active in recent months or have an underlying health condition, talk to your care provider about an exercise program that's recommended for you. And sleep. Most adults require between 7.5 and 8 hours of sleep on average per night, but this really can range anywhere from 6 to 9 hours for some people. A lot of people struggle with fatigue and getting a good night's sleep. There are tons of resources out there to help you. Some of our favorites include guided meditations, and we'll link to some of them in the show notes below. Some basic strategies for sleep include setting a regular sleep schedule and going to bed at the same time every night, reserving your bedroom for the 3 S's: sleep, sex, and when you're sick, and avoiding screens in the last few hours leading up to bedtime. If you're struggling with sleep, talk to your care provider today. We can help.
Learn your family history. Number 9. Many health conditions, including some complications of pregnancy, can be handed down through the generations. Take this opportunity to chat with your family members about their health history, as this is often information your maternity care provider will ask you during your first prenatal visit. Things to ask about is what pregnancy was like for your mother, for your aunties, and for your siblings. If they had any issues with blood pressure, preterm birth, etc. Also good to know is, did anybody have any problems getting pregnant, or were there any issues with recurrent pregnancy losses, so 3 or more? Other questions we want to know about is family history of high blood pressure, diabetes, heart disease, mental health concerns, including depression and anxiety, any substance use disorders, either with alcohol or other substances, as well as any problems with excessive bleeding or blood clotting. We also want to know if there's any specific genetic diseases that are present in your family. Common ones include sickle cell anemia, cystic fibrosis, etc. We always say if you don't know what these are, they're probably not in your family. If you're adopted or you don't know your family history, that's okay. We work with whatever information we have.
Number 10, optimize your mental health. Your mental health has a huge impact on your physical health, so it's important to make sure you're taking the steps you need today to optimize your mental health. What does this mean? Taking time to practice mindfulness. Mindfulness is hugely important in all aspects of life, but definitely when trying to conceive and when you're pregnant. And there are lots of great resources to try out. We'll link to a few in the show notes below. Ensuring you get enough sleep and exercise as we outlined above. Another really important step to take for your mental health is building a supportive network of family and friends. Despite the fact that we're in the 21st century, difficulties with mental health, with fertility, and pregnancy losses are still seen as somewhat taboo topics to discuss by many people. We're trying to normalize these issues, which is part of the reason why we're here, to talk about them. If you're comfortable, talk about what you're experiencing with your family and friends. Chances are someone you know has experienced similar challenges at some point in their lives. If not, reach out to your care provider and we can direct you to resources and support groups to connect with. Lastly, talking to your healthcare provider if you're experiencing excessive worry, low mood, increased irritability, or a feeling of being constantly overwhelmed. These can be symptoms of a more significant underlying mental health condition like depression and anxiety, and it's important to get a diagnosis and treatment initiated as early as possible. Treatment is multifaceted and often starts with a combination of mindfulness, counseling, lifestyle modifications, and in many cases, medications.
So we've covered a lot of information, and these are just a few of the key steps you can take to optimize your preconception health. Never hesitate to connect with your primary care provider to find out more. We hope you found this helpful, and we'll link to some of the resources and references that we've talked about in the show notes below. and also to our Preparing for Pregnancy handout, which covers the same items we discussed today. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our Wednesday Bump Blast, where we send out all of our free content and any special deals that we've got for you. So we really hope you enjoyed this podcast. Make sure to leave us a 5-star rating if you did and subscribe below, and we hope you have a great day.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.